Respected Honorable Principal, Honorable President of the college, all the authority members, faculties, and non-teaching friends of this college, respected audience, it is the most important time not only to discuss but also to think how to overcome this pandemic situation. Why? Just day before yesterday, we talked to Professor Jeffrey, one of the Nobel laureates at Oxford University, the great neurophysiologist. He said that pandemic situation, that is the COVID-19 throughout the world, too tough for us, as within 1 or 2 years we will be able to overcome from this situation. But another one, the pandemic situation has already started and is coming. And most of the people, the leaders of the country, of every country, even the psychologists, doctors, biologists, they are not thinking about how to pandemic situation. What is that future pandemic situation? A large percentage of people throughout the world, they are now affected from mental health problem, or they have a problem of mental well-being. Yes, the main causative factor of it is the COVID-19 pandemic situation. But after 1 year or 2 years, or even maximum after 3 years, we will be able to rescue ourselves. But how to overcome the situation, that is the psychological aspects of pandemic situation, which are coming and which has already started in all the countries throughout the world, including in India and Indian subcontinent. In yesterday, Anandabazar Patrika, a daily newspaper of Bengal, in that newspaper, what we observed, we found that 2 persons, they suicide. It is because of lack of their income in this pandemic situation. And about 1 week ago or so, one of them from Habra Thana of West Bengal, of North 24 district of West Bengal, he discussed with his wife that now there is no situation to collect the bread and butter for 4 members of the family, but that is husband, wife, and 1 daughter and 1 son. For last a few days, they took food only 1 time, and in night they take some food for their babies only, not for the husband and wife. But she observed, day before yesterday morning, she observed that, she noticed that her husband had suicide done. And this is not the first time. What we found nowadays, that the total educational scenario in the school, college, universities has already been changed. Now we need the electronic media to use, social media to use. The questions arise from different angles. Number one, all the teachers from the government schools, colleges, and universities, they paid regular their salary month after month, including me also. But how many teachers of West Bengal, of entire India, can use the electronic media, social media to continue their classes, to complete their syllabus, maintaining a high standard, a good standard? So this is a great question. And most of the teachers in the school, colleges, and universities till date, they are reluctant to come in the social media or electronic media to take classes of their kids, of their learners, of their students. So it has stopped the total education system of the country, of the state, has already stopped here. The number two, if all the teachers become expertise within 1 week to use the electronic media and take regular classes according to their routine work, but how many learners of this state, they had one smartphone, Android phone? How many amongst them have net facilities in the remote corners of the country, of the state? And what is the support from the government regarding the electronic media, regarding the internet facilities? The internet facilities still date are not available, and I, being situated in, I don't know whether I will be able to complete my discussion because the net condition today, and it started from yesterday, today and yesterday, the net situation, net support is not so ideal, is not so available for us. So the questions arise whether everybody, every student's family purchase the internet link website, quite impossible. So what will be the ultimate procedure, ultimate path to teach our learners so that the learners could not be stopped here for their education? Yes, the education minister of Bangladesh for 1 year our students school. How much loss will be there? How much they will be loser for their future aspects? But the parents, if you have corona, you took the schools, universities, you accept it. Show me the common people.
Sir, you are not clearly audible.
The leaders of the country, till date, we are unable to lead our country in a positive way. That's how to continue. That's how continue which cannot be audible. But the situation is okay here. I'm not. Yeah, I'm not.
Okay,
Hello?
sir. Continue. Continue, sir.
Okay.
Now,
Okay. Okay. So, the students, the learners, the teachers, the common peoples, the researchers, the political leaders, everybody, all the laymen, everybody is affected. It is because their rhythmic daily life activities have affected. If a rhythm affected in a music, then whether that music will be acceptable by us, answer no. Then how it becomes possible if our daily life rhythm has been affected, and affected not only for a few weeks or 1 month or a few months, it may be affected for 1 year, 2 years or so, because still date we are not very much clear when the vaccines will be available for all the peoples in the country, and whether all the peoples in the country they can consume it financially. If the government provide it freely, then it's the different question. But how much age the government will take, if it is available, the government will take to support or to give the vaccine to all the people, irrespective of poor and rich persons. Just now, just now, just before starting my speech, we came to know that one person very close to my family, my close neighbor, just after one building, his building is there, and he is severely affected by corona, and the peoples they came to sensitize to sensitize their family or their rooms, etc., etc., to sanitize their rooms, their families, etc., etc. So nobody knows when and how we will be affected by this pandemic virus. So the main problem, what I think, what I talked to Professor Jerif, the great Nobel laureate in the field of neurophysiology, that we are going to enter, because after lockdown, after completion of first 2 months of lockdown, when I found that the situation is regularly increasing, then I get one advertisement in the Facebook just saying that, are you frustrated? Under quotation, are you frustrated, anxious, distressed, depressed, suicidal tendency? Talk to me. Don't stay in your, at least should talk with one professional psychological counselor or clinical psychologist or rehab psychologist or psychiatrist, or if not, if all these facilities are not available to you, you may be in the remote corner of the state, but you may have one telephone. Just if you have one phone, no problem. At any time of the day and night, I am ready to talk with you. And honestly speaking, at least 25 to 26 people talk to me that they have suicidal tendency. They are highly distressed. They are highly distressed. And I talked with them. Within one day, I talked for 8 hours in the telephone for one after the another. And what I found, those persons who interact with me through telephone hotline, they almost in all cases, they don't suicide, but almost in all cases, they regularly answer me that, okay, I am bit better. Okay, I feel that I have future. The days are coming. Somebody, they lost their service from the private sector, and therefore there is no other alternative to maintain their family for bread and butter, at least for 2 times. But they answered that, as per you, the good days will come. We can wait. We can wait and wait. Days will come. But what I have done, that Professor Jeffrey has said, that you have to talk regularly. You have to talk continuously. And when they stopped talking with me, either by phone or by WhatsApp, I did not stop to talk with them. At least I am making a ring, calling them, how are you today? How are you now? Have you any problem? Talk to me. So even some people, just day before yesterday, one woman asked me, what is your fees? I answered, no fees, because it is the telephone hotline. So in all the Western countries, particularly the American and European countries, telephone hotline counseling facilities are there from the government as well as from the private sector. But in India, if this term is almost new, somebody may know it. We must proceed with the teachers. Why a 9 students, due to non-availability of the smartphone, because he is unable to go to the class. Why a student of MA in the hotline because she has no such facilities. And therefore, the problem is that how to overcome this situation. So we have to think about it. This is the pandemic situation which is going to be. And Professor Jeffrey said from his laboratory that now experimentally he is doing his studies, his research work in this particular fashion regarding how the future days are coming. And therefore, the mental health problem as well as the educational problem is a major problem for any country throughout the world, and as well as for our state and country also. We should think about it. Think we need more and more counsel. I feel all the teachers in the primary and secondary standard took their B.Ed degree, diploma degree in teachers training, and in every program there was a short unit or sub-unit on behavior therapy, or at least on guidance and psychological counseling. If I am not expert, okay, I may not be expert, but at least those who have that expertization of talking with the people, of talking with the mentally ill patients or persons having mental health problems, they talk with them. That you please be guide. I personally, with the support of Arogya Sandhan Charitable Trust, one humble trial we have taken with Arogya Sandhan Charitable Trust and Kontai Prabhat Kumar College of East Midnapur District. We continue a 6-day behavior therapy webinar cum training program, and from 24th to 29th of this month, just yesterday, we have completed that. And what I found that a good number of people, they became interested regarding how to talk. What are the particular type of problems the people are facing and how to solve their problem. Because people will come to me through telephone and will ask me what to do because of the lack of food, lack of medicines in this particular time. Because of financial crisis, I have lost my service or my business, small business has already stopped. Then how to continue my daily living in my family? Perhaps it has no answer. We can ask only, think about the alternative mode of income. That at least, or if you are unable to do so, you can go to the government, you can go to the nearest leaders so that you can take the foodings, the food grains, the government. But the problem is here, the main problem is from the middle class family. There is no problem almost for the upper class family persons, almost no problem for the lower economic standard people. It is because those people who have very low economic standard, they can easily take the ration from the government. They can go to different private organizations, rehab organizations for getting the food grains. What about the middle class families? Those who are middle class families, that they stand in the queue for taking ration or for taking the food grains from the government or private sector. So they are affected most. They are not only affected for food grains, but rather they are more affected for psychological problems. So psychological problems, and again from Arogya Sandhan Trust and Kontai Prabhat Kumar College, we are going to organize the second behavior therapy training program through webinar from on and from 16th of August, because we need a good number of people, a good number of teachers, a good number of educated persons who can talk to all people without taking any income facilities from them, or if possible, those who are able to provide something money, they can talk with themselves for monetary support. So we need the behavior therapy training. We need psychological counseling training, and the same is applicable for the teachers. Till date, the schools are closed. The teachers, at least, if possible, can talk to their students at least one time. to their children as the client, rather to all the parents or family members or the guardians regarding how to adjust in that particular situation. And if the teachers can use a fraction time from their very important schedule, they will be able to support neither only educationally, obviously educationally, but neither only educationally. They will be able to support psychologically. They will be able to support the family members as well as the learners from emotionally they can support at least to them. And through discussion, through talking with their learners, with their family members, with their guardians, they will be able to understand the present emotional state of the learner, the logical state, what types of problems they are facing, not only from academic point of view, but from other aspects also. The social problems may be there. The children, particularly the kids, affected most, particularly the special need children, that is those who are the disabled children of different categories, of different types and ranges. They are affected more. Why? The question arises because the particularly the intellectually challenged, autistic baby, the child with ADHD, attention deficit hyperactivity disorder, the child with multiply challenged, multiple types of problems, the child with multisensory impairment, that is the deaf blind, they can't understand why they are not going regularly to their special school or to their inclusive. They are not going to the early intervention centers for taking different types of therapeutic intervention or training. Why? The therapies, the private therapies, the private teachers who are trained in special educator or even not trained, who are in co-curricular activities like the music teacher, drawing teacher, etc., etc. Why they are not coming regularly in my family to teach me? Why I am not going outside? What's that cause? Why the playground is now closed? Why? Even particularly in Calcutta metropolitan cities, why there is no us, particularly the children, the learners, the kids, to go on the roads. We are bounded. We are closed in a very small flat, like a cage, or in a building. There is no air. There is no freeness. There is no irregularity in my life. All the regularity of my life has stopped now. How to overcome this situation? So even the kids, even the children of pre-adolescence and adolescence periods, they are affected very much. Though for them, incoming problem is not the problem, because their parents are responsible for their bread and butter with their peer groups. Never a peer groups. They can't interact peer groups in the school, in the playground, in the therapeutic center. Okay? Then how to time? This is a major question, and all the audience present here are requested, according to Professor Jeffrey, that you must prepare now, just from today, just from this point of your time, how to support the others psychologically and emotionally. And the same problem is for the people, old age people, the senior citizens of the country. A good number of senior citizens, they now cannot go outside for morning walk or evening walk, or for some stories, some talking with their age mates in certain points. So they are now caged, but they don't know how to overcome the situation. The another major area of thinking is those who are affected from blood sugar. A blood sugar patient needs different types of medicines. His or her main need is exercise, that is walk and walk and walk, either in the morning or in the evening. But the sugar patients, they close themselves in a house, in a building, because they are more prone to the pandemic situation. They are more prone to be affected by the corona or such type of virus, COVID-19 virus. So, they are not permitted by their family members. They are not permitted by the doctors to go outside to work. And in almost all the families, space is limited. This space is maybe sufficient in the remote corners, in the villages. But this is insufficient to work in the city-based, town-based families. Even there is no space for working. So, consider them. And not only that, these patients, those who are sugar affected, those who are pressure affected, those who are affected from cancer, they are very much prone to type of problem, this type of infection. How to overcome them? How to support them? Biologically, as well as emotionally, as well as psychologically. A question arises. It is not the situation that the government of India or the state government can just now train up thousands and thousands or lakhs and lakhs of professionals to tackle the psychological problem of the common people. It is quite impossible. We can't think about it because maybe, may not be, the government, the authorities not thinking about the psychological, the emotional pandemic situation which has already started in every corner of the country. And not only started, there is no vaccine by which we will be able to control our emotional condition, our psychological condition. Depression is going on. Day after day, we distressed and distressed. Day after day, our level of anxiety increased. Day after day, all the peoples of the family, of the country, they are frustrated. Then the question arises, how to overcome this type of mental ill health situation or pandemic situation which have already started and which are coming very speedily, which are running very speedily to knock the doors of each and every family of the world. In the Western countries, particularly in European and America, I think a good number of psychiatrists are there. A good number of psychologists are there. A good number of professional counselors and behavior therapists are there. But deficiency, lack of such number of professionals in the field, in this field, that is the mental health field. The college and university authorities, those who are regularly arranging the webinars, and a good number of webinars nowadays are organized in the field of mental health problem due to COVID-19 situation. It's okay. It's a very good idea. And at least to some extent, awareness program is going on among the educated people, those who are interested to join here. But a 2 days training, a 2 days webinar, a 2 days lectures by different peoples of the country or from the different parts of the world are not sufficient. Because there is no consistency of training. A consistency of training program must be started by every school, college and university authorities, even for the parents in their language, so the parents can understand their psychological problems, the psychological problems of their baby, the educational problem of their baby, better to say the adjustment problem of all of their family members from the cradle to the grave. Without doing so, what we are doing now, we are just defining so many different things. We are discussing about different things, but those which will not support to aware the mass regarding the future pandemic situation. We are not thinking about it, that how our professionals means here teachers are also not only the psychologists or therapists, not only the psychological counselors, but all the teachers, they are again the professionals. So how our professionals can support all the people of the country? Because the professionals, they are well known more or less about the counseling program. And a good number of books are nowadays available in the market. Anybody can purchase books. Anybody can download such types of materials from the net, and they can read it, and they can support all the people, so that we have not to see at least one individual, he or she died. Because before suicidal tendency, in most cases, the people have withdrawal tendency. They withdrawn themselves from all others, and they are less interested to talk with others, because they believe that talking with others has no good at all. What is the need of talking with others regarding my problem, my behavioral problem, my thinking problem, my cognitive problem? This pandemic situation created our cognitive distortion. This pandemic situation created our cognitive distortion. That is distortions, breaking of our thought process, that there is no scope to go outside this thought process. What the teacher's role, what the researcher's role, what the psychologist or therapist's role, what the educational institution's role, or the roles from the state or country, that we must support to all people, even by using the social media, by using the electronic media like TV, like radio, like daily newspapers. We can discuss in detail about what are the exact problems we are facing and more complicated what type of we must face. That is, we need support from others. Talk and talk to others. Our most beloved poet Rabindranath Tagore, in one of his poetry, he wrote, কথা কও অনাদি অতীত অনন্ত রাতে কেন বসে চেয়ে রও কথা কও কথা কও. So you must talk regularly. You must talk regularly either among the family members, among the neighbors, either through telephone, through media, through WhatsApp, through Facebook, or through all the other medias. So many different types of more powerful medias nowadays are available in any part of the country. So we can support. Somebody may thought that, sir, you told that it is my responsibility. It may be your responsibility. It may be the responsibility of the government leaders, the authority. It is not my responsibility, sir. I am the government employee, and therefore I am getting the salary, whatever amount it may be. I am responsible to work as prescribed by my authority previously, not new things. I am not interested to learn new tasks, new things regarding how to restructure distortion of thinking, how to restructuring the thought process, how to restructuring the cognitive process, the mode by which we can restructure all people's thought process, cognitive process, emotional process, the feelings, emotions, etc. That is by behavior therapy and psychological counseling, educational guidance, okay, or vocational guidance. All these are part of the behavior therapy program. So, behavior therapy can change our entire process. But I am not expert in behavior. It's okay. I don't know when such type of training program will be started or not, and where it will be done, and I am not interested. But at least I can talk to others, talk and talk and talk continuously to those who are distressed, to those who are depressed, to those who are anxious, to those who are frustrated. So we must think very clearly from the line of Professor Jeff. And when he found that we are organizing a 6-day webinar cum training program on behavior therapy, not the entire behavior therapy, but only a small part of behavior therapy, and it will be completed, expected, in 5 or 6 consecutive webinars. Here, sir, this is the most ideal task that everybody should think about it. How to change your thought process, how to change your behavior, how to change your emotional problem towards the mentally well-being process, that I am emotionally balanced. Everybody must be emotionally balanced, and it is our responsibility, for which there is no need of higher degree like the medical degree. Because just now if I can start to practice in medical line, it is quite impossible because this is a long journey for me. But what I said today to all of you, at least to those who are present here, not a very tough task, but a very easiest mode of task to change the people's pain. You must share one of my daughter. Daughter means the girl student who completed her master's program from some other university. At the time, I was the guest faculty of that university for taking classes uh, uh, one day per week. She talked to me just a few days before, shared his problems, his pain, his grief, his sorrow, his present situation, which is very much negative situation. And after a few days of continuous talking with me, she raised a specific question to me. Chef, being a counselor, maybe an expert may not be, you continuously talk with others because I get chance to talk with you after a long period of trial. Somebody, that is, you are engaged with somebody. Okay. But like me, a good number of people, those who came to you through telephone hotline from the different corners of this state, not from different corners of this country, rather only from different corners of this state. How you became interested, how you face to receive regular pain, regular sorrow, regular frustration, regular depression, and all the negative ideas, all the negative things. Have you do not facing any kind of problem? I answer, my dear girl, you are right. Yes, sometimes truly I am facing the problems when I remember it. I'm not interested to remember it, but my mind, I can't control the all aspects of my mind. I'm not such an expert in the field of rehearsal. But I try to my best to act like a piece of glass. When you are present to me through telephone hotline, you feel that I am a piece of glass. You stand in front of me and you said what you want to say to make yourself free so that I can guide you in a positive direction. Okay? But when you go from this telephone and maybe another one is coming or came, I've already forgotten your views, your feelings, your emotions, your pain, your sorrow, your grief, either. I would be a mess. I would be totally abnormal. You can think, you can remember one cinema that is Deep Jele Jai. It is a Bengali cinema, Deep Jele Jai, where the sister of the mental health hospital finally affected, that is, she became mentally almost abnormal or mentally ill, her mental health affected. Why? Because she was attached with another one client, male client, who was mentally ill, and she continuously talks she continuously interacted with that male people and so much involved. She was, that sister, that nurse was so much involved in the hospital, in the medical sector, with that client, that finally the individual, the original client, the mentally ill client, he became normal. He became totally normal. But the madam, the most respected madam, she became mentally ill. And sometimes this type of examples are available in the different parts of the country. So you, as a counselor, as a teacher, as a professional, at the same time, during talking, at the same time, you must behave in such a fashion that you will accept all the things because you are not sympathetic with your client. If you are sympathetic with your client, then you will show your negative attitude and finally any result will not come to you, neither to him or her. From the empathy from very core of your heart. You must be empathetic totally. And your empathy will be reflected upon your client. Only then your client will be supported psychologically, emotionally, and in respect of healing. So, my friends, my dear audience, respected audience, it is my view that what in this situation what I myself can do for the betterment of the society, or if not for the betterment of the society, but for betterment of our learners, of our neighbors, of at least some people who are interested to come to me, we can support them. There is no need of money to support them, to support others, only need of time. And you, the teachers, the researchers, the most respected people of the country, of any society, now you have sufficient time in your hand to use for all the common people of this country, of this state, of your neighbors. This is my only expectation to all of you. Please come forward. This is a very much problematic situation. Please come forward. If you have something extra in your pocket, in your mind, in your time, please support others. Don't be stayed as that I don't nothing, I am an ignorant. Thanks to everybody, to Professor Bhim Mondal, my bosom friend also. Just now I find him in the media. So thanks to administration, thanks to everybody for asking me to come to you and to telling a few words that may not be very much important to others, but to me it is very much important, sir. Thanks to everyone.